Hello? 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 Hello?
Uh,
Is that Joshua?
yes.
Yeah, you joined yesterday, but you you had your microphone on, but you were not contributing.
Sorry, I was at work.
Okay, can you turn your video on, please, and put your full name in the chat room for me, please?
Can I turn my work on my video?
So again, full
Okay.
name, full
Okay.
name in the chat, please. Full name.
Okay.
All right, and then Joshua, could you turn your video on, please, briefly? Are you at work today as well?
On my way to work again.
So a busy man then.
Yeah, seriously.
How many minutes to get to work?
I'm having a 3:30 actually, but I'm still on the way.
Okay. You can turn the video off then. Can turn the video
Uh,
off then. Okay. So let's crack on, Joshua. Joshua, yesterday we had Unit 3,
mhm.
and then I'm not too sure if you paid attention to yesterday's lectures.
Yes, to be sincere, I was just in the class because I was at work and I kept reading
Okay.
what I can read and I keep hearing what I can hear.
Do you access the videos at all from model?
Say again, please.
Do you have access to your model?
Yeah.
You do. Okay.
Yeah.
That's fine. That's fine. That's good to know. That's very
Actually, I don't really understand because I used to have class at 11 o'clock before. So I don't
good.
know what's changed. I don't know. Maybe this is my right class. I just don't know.
This is your research as unit research.
Oh, research units.
Yes. Are you not part of the research unit? you're doing other units, but then you need to do a research. Which course are you doing? Which level are you on?
Level 3. That's what I want to ask. Level 3.
And level 3, are you not meant to do any research work or something?
I'm not sure.
You're not too sure.
Yeah, because I used to have class from 11 to 12, which is 1 hour. But I noticed they stopped sending me link, and the message I have now is from 2 o'clock.
Yeah, I think that's the right group then, because most of the students who are coming are two to three. Yeah, I'm sure.
2 to 3. So there is no class for 11 to 12 anymore.
There might be, but you need to check with the office because that may be a different unit. You understand me?
Yeah, that's what I'm trying to do. I will
Exactly.
check with
That's a
them
different
actually.
unit.
Yeah, I think that's a different unit. I'm
Exactly.
going to message them today and
Yes.
let them know. Thank you very much.
You're welcome. That's a different, but there's also a unit that you need as well. It's another unit. This unit, yes, another unit that you
Okay,
need.
I still have to be in this unit too.
Exactly. I think that was the reason why you're on that group. Yes. Yes.
Okay. Do you
So
mean
that you
I
can
still have?
clarify from them.
Oh yeah, I will clarify from them. Actually,
Because most of the guys on your group, they have been joining. So I don't know.
yeah, that is so because it's really very confusing because I don't know. I used to have class at 11 to 12 every Saturday and Sunday, but
Maybe you're not supposed to, but you can clarify. Okay.
yeah, I will message the one of the guy I used to message
Okay.
today.
Okay. Damilola, Damilola, somebody asked you. I wanted to clarify which unit she's doing as well. Damilola,
Good afternoon.
please, which unit are you on?
We just completed unit 4, so we've not done unit 1, 2, 3. So we had a Zoom meeting 2 days ago
Okay.
because I told the person that handled the meeting that I've been doing self-reading for those courses. And he said, and I asked if you can go ahead with the assignment, which he agreed and said yes.
Oh,
So,
okay.
because if you go on those modules, you will see some videos and studies that is already on it.
That's true.
So you can, so it's a bit clearer for self-reading.
Okay. Okay. Joshua, do you understand?
Yeah, actually, seriously, I don't know. I'm very confused. It's confusing me. So I have to clarify today and clarify what's going on.
So Joshua, you are on unit 3, right? Level 3, right?
Yeah, I'm doing level 3.
Damonila, have you done level 3 already?
This guy, they tell you, no, I've only attended level unit 4 module. So I'm just doing self-reading for module 1, 2, 3, which I'm allowed to do my assignments if I'm done with it and submit.
Okay.
Because as we were told yesterday,
Then,
we're told that it's not as if those classes will not still be done. They will still do those classes. But for the sake of time, or for those of us that needed it, maybe urgently, you can write a mail. I needed to finish this course within 3 or 4 months. So if you need some self-clarification from any of the modules you are doing on your own, like personal reading, they can as well give you one-on-one class to explain better to you.
Okay.
is that not supposed to be? Say, my whole question is that not supposed to be different group for different set or section of people during the course?
What the lady really said is that the classes is always ongoing, that they started from module 1, 2, 3. I think when we registered, they were already on module 4.
I started
And they
with
can't,
one then.
and they cannot just stop it. So we just join the
Yeah,
class where we meet it. Then
it's
we'll
confusing
continue
because
like that.
yeah.
All right. Are you okay, guys? So can I proceed? So we have Damonila, as part of our practice, Boluwafi, can you all put your full names on the chat room for me, please? Sorry to bother you. Ibana have just joined as well. Full names, please. That's roll call. Emmanuel, full names, please. Full names.
All right, please, sir.
Joshua, which your lecturer?
Yeah, seriously, when I first started,
Ani-
it was a woman.
Anita?
Yeah, I think so.
Okay. Okay.
Have you done, Joshua, please?
Say again, please.
I said, which of the units have you done so far?
Joshua, can you hear Deminola?
I think the summary of the whole thing is that we join the class where it is. Then when they complete now, we are in unit 5. When unit 6 is completed, we talks about the project. But for those of us that join, we can't do the project except to have done with our unit 1, 2, 3.
Amazing.
And that is why they allowed for self-reading.
Amazing.
You know, some of the lecturers, once they are here, they will tell you they are doing recording. All those recording are always on the modules for you to see or read later on.
Amazing.
So that's why they said we can do some self-reading. If you know you need it urgently, then you can submit your assignment ahead.
Amazing. Amazing.
Joshua, sorry, I understand. Is all the unit is from unit 1?
You said what?
Oh, is the unit is from 1 to 6, right?
Yeah, it's 1 to 6.
So when we are done when we are done with the unit 1 to 6.
No, they say even if we have any question, we're not done with units 1 to 6. Sorry for cutting you short, but that if we read and we don't understand,
it's all right.
We can always ask questions on the, yes. They say anytime we put in question on the WhatsApp, they promise they are going to reply us immediately.
Actually, let me tell you something. When I first started, they said every unit we are going to be doing assignments. Are you with me, please?
Go ahead. We can.
Okay. They said what they said to me, the first unit we did, they said every unit after the lecture, so they will do assignment week for us. After the assignment week, we can go ahead and do the assignment and submit the assignment then. But I could remember we do unit 1, 2, 3, and 4 then, before I could not receive their email again anymore. And I messaged them that I wanted to submit my assignment. They said I can submit anytime I want. So before the class now change now, it's like I'm lost. I just don't understand the whole process.
Have you done units 1, 2, 3, 4? Like what you said, have you done that?
Yeah, I think so.
You've done a lot. You're supposed to have submitted your assignment. The moment they finish the class with you, you submit 2 weeks. They give you 2 weeks to do your assignment.
It's because I was very, very busy then due to some personal reasons. So I messaged them that I am busy. I cannot meet up with the assignment. So they sent me a message that I can submit my assignments anytime, which is fine. But the issue now is the unit finished because they just changed the time from 11 to 12 to 2 o'clock. That's what I'm confusing about.
No, don't be confused. Don't be confused, Joshua. I think each lecturers have their times of presenting their classes.
Okay.
Yeah, because the module 4 lecturer, she put it for 11, which although it doesn't suit most of us, like me, I wasn't really comfortable with the time, but that's the time she chose to have our lectures. But with Mr. Daniel, his lecture is always from 2, which I'm okay with. So I think each lecturer comes with their time of presentation for classes.
Okay, maybe what I'm going to do is going to message them and ask for the link of why did they stop sending me the link of 11 to 12?
Okay, better.
Yeah.
Or maybe they are thinking you have overdue on that class. You're supposed to have graduated and leave.
I just started like 2 weeks ago or 3 weeks.
I'm just joking. I'm just joking.
Yeah. I think now I'm going to message them and let them know when maybe they stop sending me the email or they are sending it somewhere else because they used to send it to me directly before.
Thanks, Joshua.
I'm sorry
thanks for having you on board as well.
Please,
Rachel,
I think.
Hello, you might not go ahead. You might not go ahead.
I think I'm trying to understand what Joshua is saying because me too. I started earlier and I finished with unit 1, 2, 3, and 4.
Yeah.
Then remaining 5 and 6. That's what please you took over. So
Yeah.
my model, when I tried, because you need to look through the model through your assignment before you can able to send your assignment. I'm
Yes.
done with assignment. I'm done with my assignment 11 with only unit 3 assignment. But
Yeah,
I'm
me too. I'm
trying
done
to
with
check.
level 1 and 2 assignments.
Yeah, I'm trying to check the model. But when I said through the model, they said you've not registered any distance yet, and the link is not coming on the model. For me, I also called them, complained, but they said they are going to see to it that everything is done. So then the lady that took the call said they are going to give us an update to send our assignment within 4 days. For which today I am promising that I want to send it today. The 3 that I finished, I want to send it today. But for the other 4, for that of unit 4, no unit 3, for instance, unit 3, I want to look through the model and see what my tools I can use through the model 3 before I can send the model 3, the assignment 3.
Yeah, because after every module, they used to tell us how to do the assignment, something if
Yeah,
you remember.
yeah,
And
yeah,
now, are they still not sending you link again? Because I can't log in 11 o'clock. They are still
yeah,
not sending
yeah.
the
The
link.
same thing. I can't log into the model. Everything is off.
Yeah, that's what I'm saying. If they're supposed to
Yeah,
have different class for different people, okay. If they are going to join everybody together, okay, I understand. People comes at any time. Me too, I come at a time. I don't even know. Someone just introduced me and I was lucky to be on unit 1. They should just be participating. They should just be updating us about group like we're having a set of people. I don't understand. Everything just, you know.
Okay.
Maybe you've joined the meeting they had 2 days ago. I think those are the proper people that would have been able to answer all these questions.
Yeah, I
Because I
think so.
think they were the one in charge. They were saying, so you can message on the WhatsApp and just tell them you needed to speak to any of the person from the school.
I
They will
think the
definitely.
admin. We can talk to the admin because
correct.
Yeah,
she's the only one to talk to.
exactly.
Yeah.
Okay.
Correct.
Exactly.
He's always reply. Actually, I will talk to him.
Correct.
Yeah,
Correct.
thank you very much. Anyway, guys.
So can I clarify, Emmanuel and Joshua?
Yes, please.
Have you had your assignment discussion for your various units? Have you done that?
Yes, we've
Yes.
done. Yeah, we've done that because I make sure I always join every Saturday
Okay.
after.
So if you have done that, normally you have 2 weeks to submit your assignment once you have done assignment discussions
Oh,
for
yeah,
every module.
yeah, that is it. That's what she said then.
And so have you submitted your assignments?
Yeah, that's the problem.
For
Because
me, I have not submitted mine. I'm
me
trying to
too.
do it today, like this evening, today, because
Okay.
like the person I called said they will see to it that they will consult the lecturer to give us 4 days addition to the 2 weeks supposed to end yesterday.
Okay.
So
Then that presupposes that there's a reason why then they've added you to this particular unit as well, because once they've ended your lectures and you are just awaiting to submit your assignment, they can also schedule you for another unit, which is the unit you're doing now, Joshua.
Okay, maybe.
You understand me?
Oh,
Because
yeah.
you've ended your lecture. Because once
Okay.
you've done assignment, that's the last bit that you do for every model.
Okay.
Assignment discussion. So once that have been done, and you are meant to submit your assignment, you can be scheduled for another new unit, and which is the research unit that Joshua and Emmanuel you've been scheduled on.
Okay. Thank
Okay.
you.
So one of it is to submit your assignment, the other is a new lecture. You understand?
Okay.
Yes, please. Okay.
All right. Rachel, could you have your full name on the chat room, please? As a matter of a roll call, please, Rachel.
I didn't hear you.
Your full name in the chat room for me, please.
All right.
And gentlemen, for those who can turn your video on, just briefly, it's part of the procedure, the rules of lectures. Briefly, let me
Okay.
see your beautiful face, your Sunday beautiful faces,
I may be.
the anointing from your churches.
Some of us
Then,
are about to go.
about to go rather. Is it Emmanuel?
Yeah. Yes, please, me.
Emmanuel, what kind of church that you by this time I'm now going to go?
It's Grace Temple.
Okay.
Go around 4 o'clock to 6.
Hey, this one not be
Yeah.
small. Okay. Is it in Manchester?
No, it's in Lincoln.
Oh, yeah, Lincoln. Okay.
Yeah.
So I've seen Emmanuel. I've not seen others. So.
Have you seen Joshua? I don't even know what's going on.
Oh, Joshua, I've seen you. Where's my lovely sisters? Rachel, Damolula, always bothering me. Damolula, where is she?
I'll put my face there. Well,
Oh,
but
the
I'm not
yeah,
watching you. It's Rachel that is your friend, right? I'm not your friend. Yeah, it's okay. I'm not angry.
Damilola, lovely seeing your face once again. And
All right, thank you.
where is Rachel?
I'm here, please. I
Rachel, I
don't know what
can't see you. You are in the dark. We can't see you.
Oh, okay. Maybe I'll go to a brighter place where I'm here. Can you see me now?
I can see you now.
All right, thank you,
Then
sir.
is it Temitayo? Temitayo, please. Boliwatifi, please. Please, I can see you briefly on video, please. Oh, I'm sure they might be at work, so they are not even paying attention to us.
Please, after seeing us, can we go off again?
Yes, you can. Yes, you can.
All right.
Yes,
Thank you.
can. Yes, you can.
Hi.
Oh, yes. Hey, strong man. I've
Hi.
never seen you on video before.
Good
You're always
afternoon.
missing in action. How are you?
Okay, I'm very well.
Good,
I'm
good. You can
currently
go
at
off now.
work, so I'll be putting my engagements in the chat box.
You can.
It's good I'm seeing everybody's faces now, so that when I meet you on the road, I'll be able to say hello and trouble you as I'm troubling Mr. Daniel.
Good.
That's lovely. So, guys, let's crack on. Let's crack on. So, we've had extensive discussions on research research works or proposal. And we've had a unit 1, we've had a unit 2, we've had unit 3. And today we're trying to look into a bit more assignment discussion on units, the unit 3, which comprises of your research proposal. And then we had an extensive look into literature review. And then we did also sampling, your data sampling. And then we did a bit more discussion on the methodology, which is presenting your sampling into a bit more practical data for everybody to see. And then we spoke about conclusions and recommendations. And then we diverge a bit more into how realistic should your sampling be or your project work be. Should it be very realistic or should it be validable? It should be validated. And research works are being conducted or being presented to solve a problem or a canker, a situation for which you have seen a worrying situation that you want to contribute your personal quota, having observed the dynamics and in your family or the dynamics in your community or dynamics in your care home or something. And I categorically state that you may have a broad and I'm doing a recap. You may have a broad spectrum of issues, a diverging one that is quite complex to deal with. However, and you don't have to present your project work in a complex, diverge spectrum. Okay, you need to limit yourself. And so I made a practical example is that if you have an issue that confronts the entire Ghanaian community or the entire Nigerian community, you don't have to restrict yourself to the entire, but then you can state the mother topic and then you can then narrow it into something very narrow so that you don't have to have a huge population to deal with. It means that your sampling will be very difficult to conduct. Okay, so normally the best approach is that when you have chosen a topic that confronts the entire Nigerian community or the Ghanaian community or the younger population, you can limit yourself and say a case study, even though it's younger generation, but you limit yourself to one particular age group. So it could be 9 to 15 years, a case study of young adults or young people within the age of 9 to 14 years, or with the age of 10 to 15 years, or the age of 19 to 23 years. What you're trying to achieve is that you have a broader spectrum of issues to deal with or to work on. However, you're telling your supervisor or your reader is that you are limiting yourself to only this aspect of persons or this age group. And that's very critical when it comes to project work. Are we together? Are we together?
Please. Yes,
Good.
please.
And so today we're going to look a bit more practical format of research proposal. Now, I did indicate in all my previous lectures to you that it is your supervisor that has the final say or the final guidance or decision in your project work, and therefore you have a time frame to do that. So one of the first thing you do in your project work is to present a research proposal. Research proposal. What are you trying to achieve? You're trying to present a proposal for consideration by your supervisor or your tutor to see if it is something that they would accept. And so you do research and then you present a topic that I want to write on this topic. Your research should have validable reasons why and realistic reasons why you want to do that. And so your tutor would have to ascertain and ensure if those proposals have any merits, and if they have any merits, your tutor will give you the green light to proceed to the next stage, which normally will be your literature review. Every research should have your aims and objectives. We've had a discussion on Unit 2 about aims and objectives. Where did you say your aims are? Rachel, Damanila, Emmanuel, if you've had a chance to read and on our units, what was the difference between aims and objects, please? What are the difference between aims and objects? Are we all there? What are the difference between aims and your objectives? Are my team available? I'm not hearing the sweet voices from Damilola and Rachel. Are the team in place?
Yes, please. We are
Emmanuel, Professor Emmanuel, I'm not hearing you at all.
there. No, Professor. I think aims are what you said earlier. They are the general or broad statement of what wants or what you intend to achieve, as you said. Then the objectives are the specific. It's like you made mention of a certain word, smart, that we should search of. Specific, measurable, achievable, then realistic. That's what I can talk of, please.
Amazing.
Thank you.
Amazing. Any other contributions? I want to hear the voices of Rachel and Damanula.
I think he has actually hit the nail on, because that's the word I wanted to say, that objectives is, you can say, okay, by the time you have already said the aim, but the objectives that maybe at the end of the whole thing, you are maybe a percentage or certain things should have been, achieved or reached. So he has used the word, that smart that we need to put into consideration while we are trying to, consider or carrying out the objectives or writing our objectives.
Amazing contributions. Any other? All right, without much. All right. I mean, you guys have done tremendously well. You've made justice to the core statements that I want to hear from you. So can we liken aims to, say, maybe vision? Can we? And can we liken objects to missions? Can we say that? Can we say that? We're having discussions today. So. Today is assignment discussion, so we're having discussions. So all of us, okay. Can we say, therefore, our aims can be likened to visions, and then our objects to missions? Can we say that? Can we?
I think no.
Why?
Because they're actually, different, even though they have just a little similarity, but it's different. The vision is a kind of overall thing. I don't know how to put it, but it's different from
you're right.
And it's also different from objectives. So I think we can liken it to each other. They are different things. I think so.
Okay. So our aims are But if I clearly understood the definition of Emmanuel, it says the aims are more of the overall, if I'm right.
Yeah, it's a broad and general statement. We should
So
vision.
Rachel, why
Like
can't that be equated to visions and visions then, if that's
yeah,
okay?
that yeah, for me it's a vision. Because if
Rachel,
you are intentional,
Sister Rachel,
I'm hearing you, sir.
if per the definition of Emmanuel, if that the word in here is overall, why can't that be equated to vision?
I think somebody's talking.
Dablola, are you speaking now? All right, Rachel, I want to agree with Emmanuel that that can be likened to vision.
Okay.
Yes, yes. I will dance the music of Emmanuel that if indeed the key word here is overall, and anything
Right.
overall is your vision. You understand?
Okay.
Then anything objective, which is more specific, then it becomes your mission. Do you agree to that as well? Okay. The vehicle for which you want to achieve your overall, the overall is huge. Okay. So the aim of the research is your vision, and that is why you choose a topic, a proposal, isn't it? Your proposal is your vision. Your object then becomes your vehicle to achieving those visions. So that becomes bullet points, specific. All right. It should be measurable. It should be tangible. It should be bullet pointed. Okay. Number 1, number 2, number 3, number 4. Because that should be clearly written for your supervisor to understand how you intend to achieve those vision. But the vision is one sentence, one word. Okay.
Okay.
And so if you look at the template that you have in here, it talks about research proposal, your research proposal. So what proposal do you have in mind? It could be just a proposal. That's your vision. Huge. One sentence. Okay. So your proposal may have a name or a topic. So you have your name and your topic. Your topic then is your vision, what you intend to solve. Okay. And so you say, what is the role within the organization and how are you linked to your proposed topic of research? Then you have to state your aims and objective of the research. So having identified a particular vision that you want to. So as a church, you have a vision to start a church. But then the church need to have a name. And then the church needs to have a strategy of how they intend to run the church. And so the name of the church is Christ Embassy. Okay, it's just the name of the church. But then there should be a mission. How do you intend to make Christ Embassy unique? What vision was given to you in achieving those vision? You need to have your mission. And so oftentimes you see churches may have mission statements and you have one word as the vision. Organizations may have mission statement. They have one word, okay, to be the best company in the South African environments or to be the best um, um, hairdresser in Manchester or in particular area. But how do you achieve those best hairdresser or the best African restaurant in Lincoln or in Lincoln, one particular area in Lincoln? But how do you achieve those vision? Is number 1 to have a lovely restaurant, 2 to have good staffs or customer oriented staffs, okay, 3 to ensure. So those are bullet points. Those are your what? Your objects. Okay, so let's crack on. So you have your project, a proposer will normally have your name, the researcher, the proposer. You would have to have a name, and then you need to have a topic, which then becomes your vision. And then you have to state your aims and objects of the research. Your aims and objects of the research. Aim, you have to state the aim there, and then you have to have your objectives. So you have your name of your project, you have your aims, and then you have your objectives. Okay. If you pay keen attention to the template, you realize that the aims have no number one, number two. It only has a sentence. Have you taken notice of it? But
Yes,
when you
sir.
come to the part of the object, it has number one. It means that you have to be specific, straight to the point. Number one, number two, number three, number four, number five, number six, straight to the point. It should be measurable, it should be tangible. And that fits into the SMART technique that I mentioned before. It should be specific, it should be measurable, it should be accountable or accessible, one that is easily accessible. And it needs to be realistic. Every project that you intend to do should be realistic and it should be validated. All right? We've had extensive discussions on this, so I don't think we're going to spend much time on today's lecture. Okay? So objectives. So you capture them there. And then what's the purpose of the research? So you have a research name, you have your aims and objects, beautiful written. Then you need to show within 30 to 50 words what is the purpose of your research. So let's try something. Emmanuel, can you propose a topic? Let's do something practical. Anybody? Damanula, let's propose something. Let's do something practical. Okay. Can we choose something? Oluwafemi has also joined. Okay. Anybody, can we choose something so we want to do something practical today?
A proposal, right?
Yes.
Please, can it be controlled drugs assessment?
Okay.
A case study at
James Cook for Middlesbrough.
Control
drugs assessment.
Assessment.
A case study in
A case study.
in Green Acres Care Home.
In what?
Green Acres Care Home.
Green Acres. How do you spell the acres?
Normal acres, like, yeah.
Okay. Care home. Okay. Can you all see the screen? I'm typing in the chat room. Have you all seen them? Okay, so all right. So so we have controlled, right?
Yeah, controlled drugs assessment.
Controlled drugs assessment, right?
Yes, please.
Assessment. A case study of Green Acres Care Home. Good. Beautiful. Emmanuel. Ready. Beautiful. What is your role within the organization? How you link to the proposed top offense? It's not really relevant. That's not really relevant, to be honest. So let's proceed.
The proposer.
Say again.
The proposer, please.
No, the proposer. Are you asking? Are you asking the question?
Yeah, you said the proposal is not relevant.
No. The second one. What is the role? Have you seen that? What is your role within the organization?
As a carer.
You're a carer, right?
Yes, please.
Care support worker. Good. So, Emmanuel, what's your aim on this proposal? What's your aim? What do you seek to achieve? What's your aim? Control drugs assessment.
Yeah.
What's your aim? A case study of Green Acres Care Home. What do you hope to achieve with this project, with this proposal, with this topic?
To
So this is how you have to ask the question. What do you hope to achieve? Then you can answer it properly, okay?
perfect assessment from
Perfect
the carers.
what?
Assessment from the carers to how they handle the controlled drugs.
So can you reframe it properly again? You can do more better with your explanation. Yeah. So what are your aims?
My aims are to assess the carers to know how to control drugs, the control drugs.
Have I typed properly? To assess carers on how to control drugs, right?
Yes, please.
So
You've not seen it in the chat, please.
can you see my writings?
I haven't seen it there.
No, I'm typing in the. Can you see my sharing the screen? The screen.
Okay, yeah.
I'm typing inside. Have you seen that?
Yeah.
Good. Now, Emmanuel, there's a difference between control drugs and to control drugs. So which of them do you tend to?
I think that's what I wanted to say as well. That because when you talk about the controlled drugs, I think these are drugs that you don't even administer it personally. It has to be in check of two senior carers,
100%.
and it's not literally being in a place where anyone can access it easily.
Even from the prescription aspect.
100%.
Yeah. So it
100%.
has to
So
be
I'm
prescribed
confused.
by
Which of
doctor.
the control is it on how I don't know. That's what I wanted to also find out.
Yeah,
I think he was talking
All those,
about
like all those drugs used for like
antibiotics
cancer
or something.
that has to
Somebody,
do with
Damela is talking, but somebody's also talking on the background. It's not fair at all. Who is that, please? Okay, Damela, have you ended?
So when you talk about the controlled drugs, they are not drugs that can easily be accessed to by just anyhow.
Yeah.
It has to be someone that is well trained in the aspect of that. These are not just ordinary drugs like paracetamol or your normal drugs you just administer. They are like morphine, antibiotics. They are drugs that are used for cancers and all. So when you talk about that, I think it's quite different from the other control. I don't know how those two really work, if I'm getting your question rightly.
Okay.
It's quite different from you now teaching them or telling your carers on how to control it or maybe abuse of it. I don't know if I'm getting it right.
Yeah, I know. That's what we are. The lecturer is saying that we are doing assignment discussion. So if we can all come together and put it in correct places, we can get what we need to do.
Good.
Yeah.
Damela, so what do you think per your expertise? What do you think should be the right reframed of? Because obviously control drugs can only be administered by nurses, not carers. And so what do you think should be the best topic, control drugs assessment, a case study of Green Acres Care Home? Yes, it could be maybe for nurses, but the aims then should be properly repositioned, isn't it?
Yeah.
Demnula, are you there?
Yes, I'm there. I'm there.
So we're doing it together. So what do you think the aims? Because clearly the topic depicts that it's more to do with controlled drugs, isn't it, Damanula?
Yes, and that's why I said we must understand what these controlled drugs are.
Emmanuel has replied that he's talking about controlled drugs, the one you know, which is only administered by
By
nurses or
nurses or
trained
senior carers.
junior carers, trained. Yes, exactly. Okay, and so we need to. I want you guys to decide on the aims. We are being practical today. I want to see what you have learned, put into practice. So what then will be your aims then? Because per what Emmanuel have said, it doesn't correlate with the control drugs because the aims is more to do with normal controlling of drugs, not control drugs. Okay. So to assess carers on how to control drugs, that cannot be the same as the control drugs that we know. So once we brought carers in, then definitely it cannot be control drugs. Are we right?
Yes, please.
So why don't we be more specific then? Damanula, then we can say senior carers, or can't we?
I think you've said it, Daniel. It's to prevent the misuse of it. And that is why the restriction is being placed on it. That's one of the aims.
Okay.
To prevent the misuse of it. That's why it's not being allowed to just be administered by any other person. And it's not just in possession of any other person or the manufacturers or so. So it has to be, one of the aim is to be sure that it's not being misused.
Okay, so should I reframe? So Damanula, repeat yourself again then.
I said one of the aims of controlled medication,
Uh-huh.
controlled drugs, I mean, is to
Mhm.
prevent the misuse of it.
To
So
prevent the
that is
misuse
why
of
it's
it.
being
Okay.
restricted to a particular set of well-trained nurses or senior carers.
Okay. Please, other people, you need to be contributing, please. It's not only Damanula and Rachel and Emmanuel, please. Today is a summer discussion. Have I typed well, Damanula? Guys, I need to see others speaking as well, please.
Rachel, I think you were saying something. Rachel, talk now. Come, you are the class rep here. Come and talk.
That's true. Rachel is a class prefect.
Not true, not true.
Class prefect is true.
Rachel is not the class rep. Oh, I don't have anything to say actually. You have talked about the misuse, and I know some other maybe residents in that care home. Some people are also addicted to some controlled drugs. So that's the misuse. So I don't have anything specifically to say to what you have said. Yeah.
Well done, guys. So let's go to the object. Then what then will be the objects then? Objects. This will have to be specific then. So let's bring our minds together. Objects. How are we hoping to achieve this? Specific. How are we? Hmm? Let's crack on. Let's crack on. How are we going to achieve this? Let's crack on. Let's crack on. How are we going to achieve this? How are we going?
Is that the objectives? Are you asking for the objectives?
Yes. How are we going to achieve this?
My name is Muji. I was thinking maybe this first objective that you said through proper training, maybe like
Oh, I'm not suggesting you today. You are the ones on the floor. I'm only typing, and you have to correct me, and today I'm not. So it's you guys have to bring your minds together. Okay, Majosola, right?
Yeah.
Good.
Okay. Maybe continuous training on administering of medication. Continuous training on administering, that's in terms of time. Some patients will tell you that, oh, probably what the doctor prescribed, maybe they should be having it by 12 p.m. But sometimes maybe when they're agitated, they can tell you that, oh, I want to have it by 10. And some will say, okay, maybe the normal time is for them to have the meds by 12, but they will be pestering or being agitated and be disturbing the nurse or whoever that's in charge of meds. That can I have it at 1? Can I have it at 2? So
Majosola, have you just joined us, please?
I have.
Okay, and so we've gone that far. You are right, but then in objects, it must be bullet points. It must be specific. Okay,
That's what I said, that continuous training.
continuous training. Okay,
Yeah.
right. Continuous training. Guys, do you all agree or any? Today we are all
I don't know
learning.
whether I can add to what she has said.
Yes, if we can't it because it's one sentence. So yes,
What
if it
if
makes
what
points.
people will say quarterly training or you understand, maybe it's more so that they will know, okay, every 3 months or
I
things
need you
like this will
guys
be carried out.
to deliberate among all of
Daniel,
you.
please
Eh?
help us out, please.
No, I'm not helping. Today we will argue amongst us. Let's argue. Let's deliberate. Constructive critiques, okay? And then we can conclude to one. So because we are all learned lecturers. So Damisola have said something. Rachel,
You
let's
are
all.
saying this again, Mr. Daniel. Mojisola,
Oh,
not
Mojisola.
Damisola.
Hey, so today we have Mojisola, then Daminola too is there. Hey, today Lola people, eh?
You
No,
can just say Moji. You can call
We
me
are going to
Moji.
confuse you today.
A lot
yes.
of Lola.
So Majula, I think you've just joined, haven't you? You have just joined, haven't you?
Yeah, I just joined not quite long.
Okay, amazing. And so Majisola, Daminola, Rachel, Emmanuel,
Yes, please.
continuous training. Do we intend to make it a bit more, rigid, sound, or we want to leave it like that, just continuous training?
I think if I could go with what Rachel and Mojisola said,
Mm.
effective training is okay, which maybe can occur like once 3 months or once quarterly, then followed by supervision.
And so supervision should be the second one, right?
Okay.
Guys, do you agree or not? Guys, do you agree or not?
We agree,
Yeah.
sir.
Is it just supervision? Just that?
It's both, I think, training and supervision have
Okay.
different things to.
Okay. Is anything handover? Does it play any role in this or not?
Yeah, it does.
In what way?
When you just
Let's not forget our aims. So when you are doing this, you are looking at your topic, your aims. Okay, then you can come out with your objects. So whilst we're doing this, let's reflect that we have a topic name, we have an aim, and then out of it we come out with our objects. Okay, so let's be.
a quick one, Mr. Daniel. Are you saying that if we agree on this particular topic now, control of I mean, what's the let me quickly check the sorry.
That's it. Control drugs assessment, a case study.
Okay, control drugs assessment. You mean that after this quality of arguments and correction and all, is it that that's the topic we're going to choose for our literature?
No, not at all. We are practicing today. Not at all.
Okay, so are we going to individually
Yes,
submit our topic
yes,
for?
yes. Individually. Yes,
Okay.
yes.
It
Today,
can't be done collectively like we are doing now.
no.
Maybe if I choose that, okay, this topic we are treating now, that's what I'm going to work on.
That isn't the purpose of you mastering project work. That isn't the purpose. Normally, there are project work that involves group. That's that's what, but this is not. However, these are discussions that you could have with the back office. Okay.
Okay.
Yes, so you guys can come together and have that discussion with the back of it. But the purposes of this lecture is for you to master individually how to, so to speak, enhance your knowledge in project work or research proposals. But this, I'm becoming more practical. I want us to do this so that we can have hands-on in your study on research work. Yeah. So this is not something for us to, but we are only practicing. Okay. Are we there?
Yes, please.
Good. So we have topic controlled drugs assessment, a case study of Green Hectares Care Home. Amazing. And the role of the person in the organization is a care support worker, maybe senior care support worker to be precise. The aims is to prevent the misuse of controlled drugs. That's beautiful. And then we say, how do we achieve that? Our object is to look into continuous training, also to look into effective supervision, so to speak. And 3, which other modalities are we going to use?
3, I think, can we put something like to provide an organized database for specified, specialized information?
Ask your team. So don't put it to me. Ask your team.
Hello, friends.
We are answering you.
Yeah, I'm saying that can we put one of the objectives to be like to provide an organized database of specialized information?
You just blow a lot of grammar there. When you talk about data and all that, please can you just make it to
Database,
my
okay, to provide an organized database.
yeah.
All right.
To provide
That's a proper info. You talked about an information about it, right?
Yeah.
When
to
you refers to data.
to
Okay.
provide.
Yeah.
I think
Yeah.
Damala, you saying something?
you made mention of handover. What in what way, if I'm getting you right?
Oh, I'm not doing your. I just proposed that. Does it play any role in your objects? It's a question that I just thrown to you guys to decide.
Yeah. I
Okay,
think that
let's look at it in this way. When you talk about handover, do you mean maybe I'm on a call tonight and handing over to the next person the next day? I don't know.
In control drugs, if
Yeah.
you observe what the nurses do or senior carers, it's very, very important that you hand over the
Yeah.
day, the proper handover of the control that have been administered. It's very important. If you look at what the nurses do and senior carers do,
Yeah.
they do a proper, and even the milligrams of how much has been taken out, they always record them if on the mark sheet. I don't know if you've taken notice of that. So when you
Yes.
talk about control, it's very important. It's very critical how much medicines have been, the milligram has been taken out, how much
Yeah.
is left. It's very, very important. They even do the calculations if you've observed. Okay.
Yeah,
And
I
so
think it plays a very vital role because one
amazing.
of the thing I know about control is also that even if I'm the one administering it now, at the point of handing over, after I've said all the necessary, like the milligrams, the dosage and all, another nurse have to also testified and signed. You understand? So it's done by the two signatory if you've given it out. So I think handover of it also play a vital role.
Yeah, that is
Yeah.
which you have provided. You have provided an organized database of what you're
Yeah.
about to give the information through your handover. Yeah.
Okay. Emmanuel and every other person, I don't know whether we can also maybe the storage of such controlled drugs.
Okay.
Okay.
Yeah.
Okay. Daniel, please help
Hello,
us out.
guys. Hello, guys.
Yeah, Mr.
Hello.
Daniel. I thought you give us break 5 minutes.
Okay, right.
But we were not hearing your voice.
Yes, that's true because I gave you break. It is this called secret
You
break.
didn't announce the break so far, so we are not sure.
It's called secret break.
Okay.
Good, good. Somebody was making a very fair point. Whilst I gave you the break, who was that? Was it Damilola? He was talking about handover, whatever was a very key thing or something. Or I didn't I pay attention or
Yeah, you suggested it, and I tried to
expand more on it, right?
expand more on it. That it played a vital role because it's in the research. It needed to be signed by two trained nurse or senior carer.
Amazing.
So at the point of handing over, it makes the other one to be on the safer side because it becomes an agreement between the both parties now that, okay, this has been given out. Yes, I can see it has been given out. This is what is remaining and all that. So that's
amazing.
handing over also play vital roles. And I think Rachel also saw something after I've spoken.
Is it? Then that I didn't hear Richie. Oh, our class P. I didn't hear very well.
Please let her.
So Damilola, before we go to Rachel, so number 4, what are we putting there then?
Hand over now. How do we put the English?
Is it just hand over? We cannot just put just hand over.
Maybe Manuel should borrow me some grammar there. Or Mojisola.
Majisola, let me hear your voice then.
Maybe hand over from a trained nurse. Oh, yeah, I think so.
Obviously, I don't want us to choose a trainer because Damisola, we've already agreed that it is only senior carers and nurses who can do that, isn't it?
Yeah.
So can we choose something else?
Like specified handing over.
Good. Is that Emmanuel? Yeah.
We agree and specified. Have you gone to work where you have encountered a nurse who have ended a shift but they cannot leave because of medication paperwork has not been completed and they sometimes they even stay even after 1 hour? Have you taken notice of that? Handover of when they don't get the things right, they cannot leave.
Yeah.
Exactly what Damnola said, because the other party have to agree with you and sign both. Am I right?
Yeah.
Yeah.
And so it's very critical. It needs to be signed. If the other party does not agree, if you don't get it right, if your paperwork, your calculation doesn't, no, you can never leave because it needs to be countersigned. Okay? Because you don't want to be cited against overdose, isn't it?
Yeah.
Right. So specify handover. Are we ending on 4? There's another one we want to add. You said Damnola says something. Hey, Rachel, sorry, class B, Rachel.
Yeah, Rachel.
No, I was only talking about maybe the storage of controlled drugs and
yes.
possibly the record keeping, correct record keeping of such controlled drugs, even if for any reason somebody who is not even there, if can see the record, the person can understand what has been administered. Yeah.
So how should we put it then, please?
Emmanuel will
One
help us
storage,
with
the another one, proper record of, how do I put it now?
record keeping.
How do I keep it now? How do I put it now?
Emmanuel, they lost out.
You said how you were you talking about the temperature of the control drugs?
Yes. That's the storage to be, at the right temperature, to be kept in the right temperature. Yeah, there are some, medications that probably should be kept in a particular degree, maybe in the fridge or outside, depending on the medication. So that's where the issue of storage was talking about. Then the other one is the I'm thinking of is how to have a record documentation for whatever is being administered.
And those documentation aspect couldn't it that be under handover, or what do you guys think, guys?
Okay, maybe to be a bullet on the handing over. Well.
So we have 5. We have continuous training, we have supervision, we have to provide an organized database, 4 specified handover, 5 storage temperature. Do we want to end on that on number 5? So
Yes, we don't want to add more. You have told us not to make it too wide.
Yeah, Sister, please.
When it's becoming too much,
I think the 5 the word 2 must be away. Then supposed to be storage temperature.
Okay.
Yeah.
Good. Good. And so let's go to the next. So the purpose of the research is to what? And so you remember that when was it yesterday? No, was it the last unit or the second? Yeah, I think so. The second unit. I threw more light on what we call uptrust. And I said uptrust is normally a way of introducing the purpose of the research, or some will say the background of the research. Okay, something brief, 4 lines, 3 lines, 30 words, 20 words, 25 words to introduce, okay, the background of the purpose of the research. And so that it includes both the objects, the aims, all together in a sentence. Okay, all right, all together in a sentence. So what's the purpose? We've identified that we have an aim to prevent the misuse of control drugs.
Yes.
What is the background? What went into the thinking? You understand? The thinking. What went into the thinking to arrive at this prevent or misuse drugs? Do we want to give a try on it? Do you want to try? Do we? Or should I give you guys as a homework for you guys to like on it? So we crack on.
Please, can you repeat I'm sorry, I was lost.
Okay, so I mentioned that the last unit, I spoke about something called uptrust or introduction. And so what is the brief introduction, few sentences, or the purpose of your research? We have an aim and we have your objects. But what is the purpose? What went into the thinking for you to arrive at this research? And in some, it is called background of your research or your abstract. If you look at any book, normally, the book, if you open any book and you open the first page, it normally tells you the overall. I don't know if you've taken notice of that. It's called abstract. Okay.
Yeah.
What you expect, something brief. Okay. Something brief, a pre-text or a summary of introducing your topic to your reader or your supervisor. And so what's the purpose of the research the purpose of my research is to what? That's the background. That's introduction. Is to cross-examine the, prevent of misuse drugs in the proper context to ensure, so what's the purpose of this research?
Please, could it be a sentence?
Yes, it normally is a sentence. It is that cannot be a bullet point. It's a sentence.
Okay.
And so if you
Okay.
look at the parameter that has been given, say 30 to 50 words. Have you seen that?
Yes, please.
Yes. So it should be few two or three lines. Yeah.
Okay. Then I'm thinking of if I can say is to test and identify any side effect of drugs. To test and identify any side effects.
I will call you. Leave me. I'm in class. Later.
Effects of what?
Of
Drugs.
drugs.
Same control drugs or just drugs?
I think okay, control drugs. Yeah.
To test and identify any side effects of control drugs. Davinola, are you guys having a go on this?
Yes, it's a good point.
Rachel?
Very important, sir.
Majisola?
That is even why it is controlled.
Yeah.
You know, I think I'm going to switch Rachel to class P to you then. Because everybody supports your
Ladies first, please. Ladies first.
Okay.
I think I know Rachel. So ladies first.
You know Rachel, eh?
Yeah.
Okay. That's fine. So for me, it is beautiful written, but it's too short for my liking. Okay. So you guys should work on it. It's too short. Okay. Your purpose should be a bit more expatiated. Okay.
Okay.
It's too short. So when you want to do a purpose of a research, your abstract, your introduction, it cannot be just few sentences. It needs to be at least have 3 lines or 2 lines. Okay.
Okay, sir.
Right. But at least you have an idea.
Rachel, class rep, support, please.
I'm not the class rep.
Support, please.
But at least you guys have an idea. So it should not be more than it should your introduction. If you look at any book, any Christian book, prayer, all those books that people write, books on prayer, books on giving, books on tithes, and you name them. You look at the first page, you normally see an abstract, an introduction. Okay, and it's they normally don't put few words in this way. You know, it's like a summary. Okay.
Yeah.
A summary,
It's
something to entice. That introduction, that when somebody reads, wow, I want to buy this book. You understand me?
Yeah.
Do you understand what I'm saying?
It should be like something like street words that will let you
it
read more.
activates the reader to want to read more.
Amazing. Amazing.
Yeah.
Either you want to read more, either you want to buy the book. So those are the things when you want to write your abstract, your introduction, you look at those. What are the captivating words that you want to put there? What do you seek to achieve? But the purpose of it, the purpose of it. So I'll leave that for you. But at least we're being practical today. We're learning that much practical. Let's crack on for sake of time. Let's crack on. So, okay, what is specific focus of this research? What are the social determinants of health and the effect on health of an individual? What are the specific focus of the research? Healthcare, but then there's a part that you are being focused on control drugs, aren't you?
Yeah.
Yes. Healthcare is huge, but then you control drugs. Is it control drugs for adults, or do we have one for youth? Or we don't know. Control drugs. No, is it for little kids, toddlers? Or is it control drugs for adults? Is it control drugs for dogs, cats, monkeys, donkeys, elephant?
Lisa?
Who is laughing?
It's me.
Davinola.
Yes.
I know you're the one who's going to laugh. I know Majisola won't laugh.
What makes you think so? Mojisola, please break this chain and laugh. Don't allow the lecturer to put me alone on this table.
I've muted myself. That's why she wasn't
Please
hearing me.
laugh, please.
Oh
Right.
my
So
God.
what is the specific focus of the research? What is the focus of which direction are you taking this research? Okay. So it goes further to says what are the social determinants of health and the effect on the health of an individual. So this I think you guys can do justice to it. Okay. Right. Obviously we have our control drugs, but then what's the focus? Are we trying to reassess that aspect of it in terms of control drugs? Focus is that more to do with adults or more to do with young toddlers, or general, or more to do is control drugs on animals. And so, what is the specific focus of your research? And then we can go to what are the key points or issue of interest. What's the issue of interest? Obviously, you are trying to solve an issue. So, what interest are you trying to solve? It has similarities or synonymous to the focus of your research. Okay. And so, but you see, all you have all these things. It doesn't mean that you need to have all in your project work. Okay. It doesn't mean that you should have all of this in your project work, but then some of it should play a role in your project proposals, okay, or your thesis proposals. You should have some of these things. For instance, you have to have your aims and objects. Very, very important. Okay, you need to have your aims and objects. You need to have your purpose of the research. Your abstract is very, very important. Your key interest is not too keen that you need to have that. Okay, the specific focus of a research, it normally is intertwined into also your introduction. Okay, and then you can look into the broader importance of the issue of interest. What are the broader importance, of this point or issue of interest? You are looking at a bigger. We mentioned that in as much as you are trying to narrow your project work so that you don't have huge sampling to collect, but then you have to also tackle the broader subject. And we mentioned that normally literature review does that because you might have picked a already published article from or a project work from what somebody has already written, and then you pick the broader part of it and then you narrow it, you argue your way out why you are focusing on one particular part of what the person has written. Okay, so um um miss control drugs. If you Google now, you're gonna have 1,001 people who have written project works or thesis on control drugs. 1,001. 1,001. But then you are choosing one part of it to argue your way out, okay, or to argue your point or advance your knowledge in those areas. And then it goes further to say to outline what points your project will aim to establish and briefly explain how this will impact upon your practice. Okay, how this will impact upon your practice. Briefly explain. Okay, and you're a carer. What will these preventing of misuse drugs or senior care? How would it impact your practice? How, when these things are properly done? We've spoken about supervision. We've spoken about right temperature and all that. How would they impact your practice? Obviously, positively. How would they impact your practice? These are things that you would have to, and these are all part of your arguments. Okay, these things will normally be under your arguments. Okay, yes, and then how will this impact your organization? What are the benefits a research project for your organizations? Okay, and then we have literature review. We've spoken about that. Also 30 to 50 words. An overview of the previously published works on a specific topic. This is the biggest deal when it comes to project work. Having written all those, you should be, this is where you advance your knowledge. This is where you tell your supervisor that you really read. Okay, right? You're going to argue or you're going to do critiques, argue for, argue against what you have read. You've picked up somebody's project work. The person has argued a certain way, but then you are looking at the loopholes and saying, look, having read this person's book, A Maslow Hierarchy of Needs, that talks about the needs of a human being expands as you grow. If you're a little child, you don't pay rent. Your dad and mom pays rent for you. You don't have much needs. As you are growing into uni and all that, you need to rent your own place and all that. You need to start paying rent when you start working. And so Maslow hierarchy of needs talks about that as a person grow, you have psychological needs, you have physical needs, you have all kinds of emotional needs and all that. At certain age, you have to marry, you have to make certain choices, you have needs. At certain age, you have to give birth to children, you have to change baby napkins, and that's another kind of needs as well. At certain age, you get old, you have needs of neck pain, needs of leg pains, knee pains, and all that. So Maslow here talks about, but then you can also look at those needs, what Maslow has spoken about, and then advance your knowledge and say, no, having read this man's, according to Maslow hierarchy of needs, 2022, he mentioned that needs are underscored by psychological, emotional, but I would also beg to differ. I want to argue that not entirely was his case true, but I want to advance my knowledge that it's not true. And this are your, but then you read, you quote, according to so and so person, this point is not entirely true. And do you understand? Do you guys understand, please?
Yes, please.
Where are my girls?
Yes, we are hearing you.
I've ended. Rachel, Daminula, and Majisola.
We are here.
Do you agree with me or you don't agree?
101%.
Amazing. So this is where you argue. This is where you tell your reader you are not you have been reading. You've read different 3, 5, 6, 7 books. You've gone online about the subject topic. Your focus. You argue. Literature review. You argue you pick somebody's right. You give references and all that, and then you argue your way. You agree with the person, but you agree with this to some extent, but to you feel that this, if it's done this way, that's what you do in literature review. You are reviewing, you are critiquing somebody's work. All right? And then
Yes, please.
research methodology, also 30 to 50 words. Anytime you hear the word methodology, what does it mean? It means practical methods, the most methods. We are what we call primary data and secondary data. Okay, you collect your data, and then you have to do what we call, you have to dress your data. You see, was it first-hand data, primary or secondary data? And then recommendation will be considered conducting the research via secondary methods. So you collect your data primarily, maybe random sampling, collect your data. Okay, but then some may be very complex data to get. It wasn't easy to collect the data. You would have done a bit of survey to collect your data. Those are more secondary kind of data. Okay, but randomly you can just go out there and meet 5, 7 people and collect your data. So what are research methodology? Okay, and those are the ones you present. You present that, gathering your sampling. We spoke about yesterday, your questionnaire, how to go about it, whether open questionnaire, whether closed questionnaire, whether through surveys, okay, whether through email responses, or whether through feedbacks, okay. These are all forms of methodology, okay. Then you have recommendation. It said recommendation will be considered conducting the research via secondary methods. Okay. I have to crack on quickly. I have another lecture at 4 anyway. And then we have your source of information. Those are your references. Okay. Insofar as you are trying to critique somebody's work, you cannot not reference the person. And references should not be more than 5 years. References, if you are reading books, your reference should not be more than 5 years. It should be within 5 years. And it should not have AI. Once you do that, you'll be disqualified. You should have your AI statement. Okay, you should not do things just AI doing those for you. You need to really read, get your information, and reference them. Okay, So sources of information, normally to be in your references, okay? And then, how many of you know what is called citation in references? Citation, do you know about that? You know, but you know about Harvard references. You know the UK, we use the Harvard type of reference. You know that.
Yeah.
Yes, please.
Yeah.
Good. So UK, whether university, whether masters, we use the Harvard type of references. And what does that mean? What's the meaning of the Harvard type of reference?
But there are some, sorry, there are some other
Olu-
courses they use
Oh,
some other
Olufayemi, is it your first time of speaking?
yes.
Amazing, amazing.
But
Good.
there are some universities, some
Mhm.
courses apart from Harvard, there are other references in
That
UK.
they accept. Oxford and all that, Cambridge
Yes,
and all that.
yes, seventh edition, you know.
Amazing. But for this uni, you know we're doing only Harvard. Are you aware of that?
Yes,
Good.
yes, I know that.
So what then is a Harvard type of reference then? Olufemi, what then is Harvard type of reference?
My name, just call me Faye.
Okay,
Faye,
Femi,
choose the middle.
what then is the Harvard
Faye.
type of reference?
I did not use it, so I don't know it. I used the other type. I told you I used seventh edition reference, so I
Okay.
didn't use that. I'm
Have
sorry.
you done any unit with us at all? Is it your first unit?
I've not been attend. Well, this like second or so class.
Have you had
Or
a chance to
yeah,
read your student model? Because one of the first thing that you need to be explained to you or have lecture is your type of reference. Very, very important. Have you not had any lecture on that?
yes. I've not been attending. That's what I'm trying
You've
to
not
say.
been
That
attending.
I've not been attending the
What
classes.
about reading?
But
Do you have access to your model, your YouTubes and the
uh,
videos and all that?
uh,
You've not.
I told, yes, I've not, because I
Okay.
told the director the first day that until the ending of October, that's when I will have
Mhm.
time. So I will start reading them now.
Okay. Does anybody want to help amongst the team? Your understanding on Harvard type of reference.
When's
Okay.
ID? Where's
Speak.
the I want to go and buy one the card.
Okay, sir. I think is you said it is citation. So it's citation style. That is an author date citation style.
What? Jesus.
Oh, so Jamila, can you mute yourself if somebody else somebody's talking in the background, please. So your Harvard type of reference, it normally good. It normally, so for instance, if you have 10 people who have co-authored a book and you are uh, having your literature review, how do you put it in your writing? How do you put it? If you have 10 people who have written a book or 5 people who have written a book
I
and
think
you are in your setting, you're trying to say, according to Emmanuel Boidu's book on um, preventing of controlled drugs, and the book was not only written by Emmanuel Boidu and there were about 4 people, how do you put it?
I think it must be in alphabetical order. That if 10 people or let's say 15 people or many people that wrote the book, same book, their names must be in alphabetical order before you
Yeah.
can able to put their names and their in test citation. That's the author, date, year, and what you need to put.
Yeah, so Emmanuel, you've done well, but I don't think you understood my question very well. Your answer relates to in the what we call the reference list, okay?
Mhm.
In the reference, but I'm talking about the literature review itself. When you are having your literature review itself, and you want to refer to a written book by Emmanuel Boidu, And Emmanuel Bedu is not the only writer. There are other co-authors like maybe co-authors like Daminola is part of it, Rachel is part of it, Majisola is part of it, and all that. And in your literature review, you want to say according to, but then there are 4 other people, so you cannot write all their names. So what do you do? How do you do it? How do you put it? Team, are we here? Team, where are the
Rachel,
team? Where are the
Yes.
team? Is somebody eating a goosey somewhere or something?
Ah, did you know?
Where are the team, please?
We are
How do
here.
you put it?
class rep, support, please.
Class rep, where are you?
Oluwa, you want to contribute? You want to say something? Okay, so since you've done some of them you've submitted an assignment, you should be familiarized with some of this. Have you realized that you normally see in often in the UK, you normally see in references, not in the reference list, but then in your literature review or in some of the writings, you see the word ETAL and L. Have you seen that? ETAL is more of a Greek word, ETAL. Instead of saying that, instead of mentioning all the names, Emmanuel Boedu, Damilola, and all those 5, 10 names, you only mention Emmanuel's name and say an all. Have you taken notice of it?
Yes, please. Yes.
Guys, are you Rachel? Have you
Yes.
seen that before?
Yes.
Where did you see that?
Well, I was actually trying to learn the Zivakoja that they call it and this Harvard referencing, but the one we are using now, we are yet to submit most of the assignments is Harvard referencing. The lecturers are asking us to do, just like you rightly said, that's what we use. But most of them, we don't quote. There are not too many authors that write such that we are referring to. So that's why I don't really have the understanding of what you are saying.
So have you got an understanding now or not yet?
I'm trying to get it sincerely.
No, please, I'm trying to get what you're saying, please.
I'm not getting it. Yeah.
Oh,
I'm
Lou, you're
not
also not understanding,
understanding.
right?
Yes.
Saying yes, yes.
Okay, so let me
I
repeat
want to have
myself
an
again. Let me repeat
understanding.
myself. So I'm saying, normally, when you have a book written by someone, okay? And the co-authors, about 7 people wrote the book. Normally you have a book that is written by 7 people. Do you agree to that as well? The co-authors are 6 or 7. Now, it is only in your reference list, and Emmanuel rightly said, beautifully put it this way, he said that you have to write all the 7 people, you need to state them in the reference list. Do you agree to that?
Yes.
You agree to that, Rachel? Now, but I'm saying, before the reference list, in your review, the literature review, you are trying to review someone's work and then advance an argument per your own. And so you'll be referring to a book that is written by Emmanuel and 7 authors. How do you put it in the review? Do you have to state all the 7 names, or what do you do? Hello?
Hello.
Have you understood my question now?
Yeah. For me, I've understood what you are saying, but you just did it. You write the first name, like if it is Rachel.
Yeah, I know
You
I've
write.
done it, but I want
Yeah.
you guys to understand.
Yeah.
I know I've
I
written it there,
understand.
but you need to
Yeah.
understand why I've written it there.
Yeah. For me, I understand.
Rachel, Olua,
Yeah.
have you understood it now or not? Still not yet.
Okay, I understood it. You said we should
That,
write the first name.
so normally, Oluwa, what happens is, Daminola, are you there? So Oluwa, what happens is it is only in your reference list.
Sorry, call me Olu. Olu.
Olu, thank you,
Olu.
Olu. Okay, all
Olua
right.
is Lord.
Yes, I know, Oluwa is Lord. I know. Okay,
It's
Then
not
it's
so
Lord.
Olu.
okay, that's fine. That's fine.
Or
So,
Fei.
Olu, what I'm saying is, imagine you have 7 books that you want to refer, and you're writing everybody's name. There are 10 people. You can imagine the time you are going to, the time constraint. All right.
Mhm.
And so,
Yes.
but it is mandatory in your reference list to mention all the co-authors. That is mandatory
Yeah.
because you finish your project work, you finish everything, but you need to capture your references, and that's the co-authors. If there are 7 of them, you have to write Emmanuel, Boydu, Rachel, all of them. But in your review, which is the raw writing in your review or in your argument,
Yeah.
you don't need
Mm.
to write all the 7 names. Do you agree?
I agree.
So in place of that, what do we do?
Yes.
Rachel, do you understand me now?
Okay. Yeah. I think in every book, because like this one, I don't know whether I'm getting what you're saying now. We'll write the lead, maybe the very first person, the lead, maybe author. Then we'll write the initials of maybe others. That's why we put this ET, or which we call it all in. That is if it's more than one. I
Amazing.
don't know whether that's what you are trying to say.
That's exactly what I mean.
Okay.
Olu, have you got an understanding now?
Yes, I have a good understanding now. Yeah, very good understanding. So
Good.
it's a lead author. Yeah.
Awesome. Awesome. Is the lead author, and the 7 others, you don't need to write all their names. Once you use the word ETAL, it means the lead author and others. Okay?
Mm.
But you do that in your literature reviews when you are arguing and all that. Because you cannot be
Mm.
quoting all 7 names. You can imagine how many books you are referring to, because you are having different
Mm.
arguments. So different books you've read and different research that you've done, and you have to quote every. No, you're going to take all your
Mm.
time. But then you have to
Yeah.
write down somewhere, because
Mm.
you need them in your reference list. So in as much as you're not writing all the names, but you have to make sure you've written them in a book somewhere. You understand? All the names,
Yeah.
so that you capture them in your
Mm.
reference list.
Yes, I understand.
Now the difference between the citation and the reference is that, Emmanuel, in the citation, oftentimes you also have to add the page number and all that. You understand?
Yeah.
Rachel, do you understand?
Not really, sir.
You know, the reference itself, okay? A reference itself, not necessarily you need to add page number in the reference, okay?
Yes.
But if you want to very, very, what we call bibliography, have you heard of it before?
Yeah.
Rachel, have you heard that before?
By bibliography.
Yes,
Yes. Is it different from biography?
it's different
It's
from
different.
biography.
Oh, I don't know it. I don't know.
Okay, read about it. It's all part of who understands that? Who understands that? Somebody said yes when I said that. Guys, somebody said yes. Oh, so should we crack on? Hmm? Okay, let's crack on then, since nobody's answering. So you see, bibliography is the list of books of a specific author or publisher on a specific subject. So in you see in the reference, you can just you have the 10 names of the co-authors, the name of the book, okay, and all that. But if you are trying to cite, then normally you would, in addition to that, you normally also add the page number where you took the information from, okay? Are we together?
Yes, please.
Yes, sir.
You even include the page number. Normally you see PG number 7, number 2. Okay, and even if you put the information for Wikipedia, you need to copy the link. Have you noticed that? You
Yes,
need to
please.
copy the link and capture it there. Okay, so these are the sources of information. These are what we call reference. So if you look at that, if it's journal articles, you need to, if it's website, you need to capture them there accordingly. Okay, if it's www. It needs to be captured there. All right. And then you
Yes,
have
sir.
your results and conclusion. Conclusion, it's how you conclude. How you conclude, you know, your conclusion, okay, or the result-based conclusion. You have your abstract, but then your conclusion, having, assess the whole thing, you conclude by saying that this research was very, and then it helped you to,
Yeah. Yeah. Okay.
okay. Then you have your ethical considerations.
Good time.
Were there
Okay.
any limitations? Research
Okay.
participants should not be
So I should
subject
put
to
it,
harm
slot it in,
in any
right?
way. Did you encounter any harm in your research gathering?
All
Did
right.
any man say, I'm not going to give you because you're a woman or those information that you needed? Was it
Okay.
dangerous in gathering your information? Maybe you are doing a research which is it's a
That's
critical
against the
area.
agenda.
Okay. Was there any protection or privacy of research?
Only on the
Participants has to be ensured. Adequate level of confidentiality of the research that should be ensured. Okay. Probably you were relayed certain information which were confidential, and for that reason you find it very difficult gathering information because some of this information were sensitive to be given to you. Okay, or being a woman, research work, you needed some
I just
information from the
call
men,
it
and it was very tough. So they are
written.
ethical consideration. All those things you need to mention them
I didn't
in
block it, but I
your
do with my daughter.
research.
Proven to protect you. Why?
Okay, who is speaking, please? We are having. Can you mute yourself, please? Can you mute yourself?
Okay.
All right. Do you have any question at all? Any questions?
For me, no,
Okay.
please.
Any questions at all?
No, sir. No.
100%.
Okay.
Okay.
I have question.
So
I'm
the
raising
ethical
up my hand.
considerations need to be
I'm raising
captured.
up my always. I'm raising up my hand.
Oh, Olu, you have. Okay, please proceed.
Yeah, please. Sorry. I mean, I hope I'm not taking you back.
Okay.
No, I'm
Are we to do for the research methodology?
Yeah.
Are we doing? Is it that we pick? Is it qualitative or quantitative?
Make sure of that.
And we. What did you say?
okay.
A mixture of those.
Is it
A
Let's
mixture
try. I
both.
think
okay?
I've done it
Then
now.
please, can we have? Okay, you
Let's
mentioned that.
Somebody's
Please,
talking, so
can you?
please.
use the card, yes.
Olu is
Oh,
on the floor, but then
sorry.
somebody else is
Use
speaking. So it's really
Dami,
it.
hello. Sorry, Dami, Lola. Hello, unmute. Dami, please, kindly
Yeah, I
unmute.
think let's
Hello,
try
Lola,
again.
Dami.
let me mute her, please. 1 minute. Let me mute her. 1
Okay.
minute.
Yes, please.
I'm going to mute her just 1
you?
minute.
Okay.
Lola.
Exactly.
Damilola. Okay, I have done. Proceed.
Thank you. Yeah, please, can you kindly give is there the recording, this video recording, will it be given to us
Yes,
for
please.
this class and the last class so that we can go back
Yes, yes, please.
and study? And then concerning the previous classes, for example, like maybe those previous classes, because we just, I think, we join. I heard I will join on 4th or so. I don't know. Can those previous classes be given to us so that we'll be able to study and go through and then do our assignments and research work, please?
Yes. Yeah, Emmanuel, you can. Yes, yes. Yeah, you have all on. Do you
Thank
and
you, sir.
Olu, hence why I asked you if you have access to your model, Olu. If
Yeah.
you have access to your model,
Okay.
if you have access to your
Okay.
model, you should be able to access these videos. I remember I sent over the videos of the previous ones to the office,
Okay.
but I'll find out if they'll be able to upload. I think we have technical issues. Remember,
Okay.
Damlola, I think the
Okay.
second one or first one, we had some issues in the past, so I'll check. If not, and you need me to engage you on, I can. But then let's check with the office if there's any video.
Okay.
Oh, yes. Okay.
Yeah.
Good. And so
Thank
I'll
you.
bring today's lecture to an end. Let's have a recap. It's an introduction should be rational, aim, objective of research. At least 750 words. Literature review, at least 1,050 words. And I said that's a place you argue your points. And research methodology, 450 words. Your data findings and presentation. How do we present? We spoke about presentations. How do we present them? Through bar chart, histogram. You remember the lectures we had last time? Our presentations are not done in vague. We don't present them in words. We present them in something that is easy to be accessible through bar chart, through Venn diagrams, through histograms, okay, through scattered diagrams or plottings and all that. This is how we present our presentations, okay? Our data findings should be done in a presentation that is easily accessible for people to understand. And then finally, you have your conclusion and recommendations, which is 500 words, okay? Okay, so we'll bring today's lectures to an end, right? Thanks for having you guys. Any question at all? Any questions at all, please? Any questions at all? Olu, any questions?
No, sir.
Rachel, any questions?
No, sir. No.
All right. So I think our next lecture will be next week. Am I right?
Okay.
For research. For research, yes. I'll share the link. Hello. Hello.
My question. Thanks.
Hello.
Okay. To the same
Is
time.
somebody asking a
Sorry?
question?
Is it Saturday and yes, I said, is it
Yes, Saturday and
Saturday and
Sunday, yes.
Sunday?
Yeah, Saturday and Sunday,
Okay,
yes.
the same time.
Yes, true for yes.
Oh, okay,
Okay.
okay, yeah,
All
okay.
right. Could you leave your feedbacks on the chat for me? Your feedbacks, eh? I need your feedbacks, please. Especially Olu, your first time hearing your voice. I need your feedback.
Okay, okay, that's all right. Oh, listen.
Are you also a carer, Olu?
Yes, yes, I'm a carer.
Amazing, amazing, amazing. So I will check the office for the recordings, but then you can also message them, the admin email,
Okay.
and then leave your
Mm.
feedbacks. Could you all leave your feedback? Daminola, Rachel, I need your feedbacks as usual, please.
Okay. Okay.
So you are on banking on level 4, right? You're level 4 health and social care. Is that what you guys are doing now? Or others are doing level 3? Feedbacks. We had hey, Woli Watife, you don't talk, but you always leave message. Okay. Then Damanula have not left his message yet. Olu not yet. Rachel has done. Bono has left. Okay. So have another lecture at 4 o'clock. So guys, I'm going to leave you soon. Let's catch up.
Sorry, I'm just hooked up at the filling station.
That's fine. That's fine. And good.
Thank you, Daniel. Thank
You're
you.
welcome. You're
I've,
welcome. You're
I've
welcome.
left my feedback. Thank you. So
Amazing.
see you again next week.
See you.
Thank
Yes.
you.
Take care. Lovely.
Thank
Bye.
you. Bye.